Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences. I'm Janet Rodriguez, the office's Administrative Director. Today we're going to talk about the School of Medicine's Integrative Medicine Track Program with its director, Dr. Mikhail Kogan, Lauren Vilardo, a second-year medical school student, and Kami Veltri, a third-year student. The Integrative Medicine Track is one of 9 scholarly concentrations, an educational program designed to enrich students' experiences, opportunities, and expose them to various concentrations of study. Welcome to GW Integrative Medicine.
Thank you.
Thank you.
Dr. Kogan, what is the Integrative Medicine Track?
Yeah, so the general track program at the university has been established a long time ago, and the idea was to create a special pathway for students who are interested in a given topic to get introduced to the mentorship early on, to get exposed to the leaders in the field, and just generally spend more time learning about the specific subject. We're not the only track. School has multiple different tracks. There's education track, community health, there's international, and others. So we're actually a smaller track. And through the 4-year medical school, during the track, students participate in a variety of different lectures. They have to do 2 separate projects, one between first and second year and one during their third and fourth year. And of course, then they spend time at the GW Center for Integrative Medicine. They also spend time in other clinics learning much more hands-on introduction to integrative medicine. And also they meet a variety of different leaders in the field.
Before we started recording, you made mention of the fact that not a lot of medical schools have integrative medicine tracks. Can you tell us a little bit about that?
Yeah, integrative medicine, or what we used to call CAM, has been gradually increasing its prevalence in different medical schools, but I think majority of schools will have a lot smaller curriculum. They would have maybe 1 or 2 lectures during the first, second year. They may have an elective course here and there, but it's really not well structured in order for, if one of the students really want to have a lot of exposure, there's really few opportunities. And I think it's based more on the fact that most of the schools, unfortunately, don't have enough faculty and they don't have enough resources dedicated to the process. I think GW is one of very few institutions that committed on institutional level to support the students who are applying and coming in with this interest. And I do want to say that there are students who specifically apply to our school looking for just this track. In fact, one of them is sitting right here with us in the studio today, so Kami will tell us in a second about her journey.
Kami?
As you mentioned, having an integrative medicine track program was a big draw for me coming to GW. I knew before I started school, based on my own healing through integrative medicine, that I was interested in learning more about it. And while my interests are still very broad as a budding family physician, and all of the track programs were very appealing, I knew that the traditional curriculum would not provide much, if any, integrative medicine teaching. And it was really special to me that there was a dedicated track program that would provide mentorship and education specific to integrative medicine that wasn't just didactic, but experiential as well.
I want to chime in something here real quick. So I think that's a key concept, that schools often cannot really figure out how to put some of the components into the curriculum, because the curriculum tends to be so busy and so packed with all kinds of stuff that they're sort of required by the ACGME to be able to prepare students for taking the boards and get into the residency, that this kind of becomes an issue on the side. So I think that was also one of the key reasons why we decided, with the track, rather than trying to keep increasing number of required pieces for all the students. So this way we select only those students who are really, truly interested.
Your turn, Lauren.
So I think integrative medicine's always been an interest of mine, especially seeing family and friends, have medical treatments that are limited or something like chemotherapy and can be harmful. So I think that coming into GW, I was really interested in learning more about what what else is out there and what else can help folks, and knowing that patients are going to be seeking out some of these modalities on their own, be it like supplements or chiropractors, things like that. And so just knowing for myself as a future physician what the evidence is for these modalities and how they can be used.
I attend some of the IM track, as I like to call it, lectures, and you all have to do how many lectures a year?
No, into first 2 years they have to finish 15 total, and they can slice and dice it however they want. We do repeat them more or less every year, so they have 2 chances of completing the same lecture twice.
So this year we've done everything I know from Reiki, mind, body, spirit medicine, biofeedback. Was there an intro to integrative medicine one that was done earlier?
Yep, there was an intro. Well, Lauren and Kami wouldn't be there because they're already past that point.
The first years.
Yeah. I think we had a talk on nutritional supplements for pain, right? Yes. And then we had a talk on, we were supposed to have a functional medicine talk, and we'll move that later. And what else we had?
There was a nutrition.
One of the ones that stood out to me during my first year was the intro to naturopathic medicine, because I had never heard of it before, and it kind of blew my mind.
Yeah, we try to cover lots of different territory, and one of the key aspects of those lectures is not necessarily you're going to learn modality, but it's really for you to experience firsthand some of the hands-on applications. Like when we do biofeedback, right, we actually practice it in the room instead of just talking didactics. So one of the things that Kami said was the reason why she wanted to come and specifically do the tract was because it was experiential. Would you like to tell us a bit about that? Mm-hmm. Yeah, you really can't practice integrative medicine without understanding what the modalities are. I mean, it's like, are you really going to tell somebody about, acupuncture or chiropractic where you never experience them yourself? So it's one of those things where experiencing is not that difficult. We usually have ways of getting students either totally free experiences or very low-cost experiences. And we try to really have them walk through a variety of different modalities. We try to be very big on mindfulness practice, so we offer students to join different classes. I don't know if, Kami, you've joined MBSR. Yeah. So mindfulness-based stress reduction, and hopefully you'll have time in the 3rd and 4th year to also join one of the classes, and we allow 1 or 2 students for free every cycle, so 3 times a year. And when you rotate with us at the center, then of course there's a lot more hands-on and a lot more visibility. You're actually sitting there with the patients. You're learning during the actual meetings with practitioners and different treatments.
If I could just add, I think that's one of the biggest draws to integrative medicine itself is that practitioners are really practicing what they preach. Everything is truly experiential. Even just being at the center, you're seeing how the practitioners themselves are living integrative medicine, not just offering it to their patients. So the center we're talking about is the GW Center for Integrative Medicine, which is Dr. Kogan's private group practice.
Yeah, it was started with the founder of our office, Dr. Pan, many years ago, actually 20 years ago to be exact. In fact, it is 20th year celebration. So, and we're still there, and we still work with our students. I think John started the track, I want to say, he's going to kill me if I'm wrong, right? Mm-hmm. So I think it was 2007 or when the track started. So the track's been around for at least 10 years at this point. And from talking to the director of the program, she tells me that it's one of the more popular scholarly concentrations that students do here at GW. Well, let me correct you. It's most likable one. I wouldn't say it's most popular.
I said it's one of the more popular.
More popular. Well, no, we're actually the smallest track, and I like it because this gives an opportunity to really work with our students in a very close capacity, because the faculty time is always short. And we have advisors, Kailan Baban, who's our lifestyle expert at the School of Medicine, and others, and so that allows us to be really close to our students and really help them through this. But we are indeed the most likable track. Our students give us usually raving reviews at the end of the year, and we want to keep it that way.
I will say that we do have some classmates who are in other tracks, but will often come to our track lectures just because they're so interesting and so applicable to our lives and how we'll practice.
So, Lauren and Kami, I just have a few more questions specifically for you, but Dr. Kogan, as always, feel free to chime in. Can you tell us a little bit about how this track has provided you with a broader healthcare perspective?
Yeah, I think Kami had touched on it, but there are so many things that I've learned about that I didn't even know really existed. And so it's really great to just be able to see like what patients can, what modalities patients can have for their treatment and for their well-being.
I'd add that it also, through the track program, the exposure to the various forms of medicine that are being practiced at the center, sitting in on some of these Wednesday staff meetings and just being a sponge and really absorbing all of the information that gets shared amongst all of these different practitioners is a really beautiful thing to see what medicine can be, to provide kind of that light at the end of the tunnel for medical students who are not exposed to these things. To see it happening in real life, in real time, is very inspiring and definitely has kept me going throughout my training by providing that light.
I want to add a couple of things. I think there's a really big need for more trainees going into careers where they can do some research, where they can also become thought leaders and teachers. And I think part of the idea of the track is not just that you guys, students, learn the subject matter, but also that you learn academics, that you learn a scholarly component. That's why some of the requirements of the track, especially in the first and fourth year, is that you do those projects that have a scholarly component. And I think the general idea here is that we want to see future leaders coming out and kind of moving the field into much more mainstream by producing more evidence, by continuously teaching. So I think that's another general scope of importance for us.
So are students doing research projects or?
If they choose to, we don't necessarily twist their arms. Not everybody wants to do research, but those who want, absolutely. So I think one of the last questions we can have Lori and Kami tell us what projects they've done so far. And some students end up doing a very advanced research. We had students publishing in leading journals, different research projects. Some students opted out to do more of an educational activity, like creating a handout for a disease or working on some kind of curriculum pieces for the school. We had a really cool project a while ago when somebody literally made a video on pet therapy, and now that's in repository for our students, if those who want to learn more. So Kami and Lauren, what were your projects in the first year?
So for me, I ended up going to a program called Leaps into Integrative Medicine. That is a collaborative project. Previously, it was through AMSA, and it brought students together from all over the country and Canada as well to have this kind of experiential integrative medicine education. And I had the opportunity to actually become the student director for it the following year. And we did some research on how it improved mental health, actually, in the students that participated. It improved their resiliency. And I got to go to AMSA the following year and present our research at the national conference, which was really great.
And I think the same work, maybe without you, was also presented at the Congress of Integrative Medicine Research that's organized by a consortium of academic health centers for integrative medicine. Mm.
This summer, I implemented a survey at the conference I Am For Us. It's Integrative Medicine for Underserved Populations. I worked on this with Dr. Kogan, and we asked providers there how and why they're doing what they're doing. So the providers of all different types of modalities, including physicians, but not limited to physicians. We also asked about their palliative care training and whether or not they felt that their training really prepared them to have palliative care conversations with patients.
So, there's a lot of opportunities to really take a very early leadership opportunity, like the Kami really jumped on and became a program director for the following year, or much more like really scholarly projects where you actually do a little study, which is what Lauren did.
Are there any questions that I haven't asked you all that you might want to share with our listeners about integrative medicine, about the integrative medicine track?
I have a question. So you guys, at this point, you're senior students, especially Kami. It's shaping your career for future, of course, and it's too early to say what you'll end up doing, obviously, but how do you see in the future what you're learning during the track will contribute to what you're going to be doing?
As I mentioned earlier, I feel like one of the biggest things I learned is how much of a lifestyle it is for the providers as well. And so for me, it's really taught me how to build my own resiliency as a future provider, and to be able to not just work with patients in providing guidance, but really being like a role model for them for what a healthy lifestyle can be, and really practicing what I preach, regardless of what I go into. These types of modalities can help in any field, and that's what's so exciting to me.
Yeah, I definitely want to echo that and add that I wasn't really considering primary care until I was in the track, and now that I'm learning about prevention and integrative modalities for prevention, it's much more interesting to me to be able to offer patients, mental health type wellness initiatives so that they can, maybe prevent disease in the future.
Kami, just to follow up on your point about building resiliency. So you're not far away from starting the residency in family medicine, which we know is not an easy one, especially in the first year. How do you think the track had helped you to be prepared for the residency?
Well, through these lectures that are experiential and some of the leadership opportunities I've been lucky to have as well, it's definitely helped me build my own toolbox of different modalities that I can use to keep myself well, from nutrition to mindfulness to Tai Chi and yoga, and even different supplements as well that I'm very familiar with now, not just for myself and getting myself through residency, but also to help guide my peers through that kind of leadership role that I was lucky to have.
That's all the time we have for today. Thank you for joining us. This is the GW Integrative Medicine Podcast from the GW Office of Integrative Medicine and Health. I'm Janet Rodriguez. Be well.